anyone سووا record meet recording كيفكم؟ Thyroiditis is a group of autoimmune disorder resulting in inflammation and destruction and functional impairment of the thyroid gland. So thyroiditis is mostly autoimmune. Rarely it can be associated or can be result from suppurative process or from infectious focus from the bloodstream. So this is an autoimmune destruction and inflammation, ongoing autoimmune process, including B cell or antibody production and B cell dysfunction with functional impairment and of the thyroid gland, and features of hypothyroidism are mostly associated in patients with hypothyroidism, especially in advanced stage. These features, including weight gain, despite weight gain with reduced appetite, constipation, cold intolerance, fatigue, lethargy, and weakness, brittle or fragile hair and nail with cracking, dry, thick skin and hair loss, mental slowness or bradycardia, mental slowness, and depression. Vocal cord thickening or due to pressure and voice hoarseness due to pressure or compression of the enlarged thyroid gland on the recurrent laryngeal nerve, and also goiter or enlarged thyroid gland. Generalized features of hypothyroidism are usually associated and usually seen in patients with thyroiditis. Types of thyroiditis, the commonest is Hashimoto Thyroiditis, or the other type is called subacute lymphocytic thyroiditis or chronic lymphocytic thyroiditis, and subacute granulomatous thyroiditis. So both Hashimoto and subacute lymphocytic thyroiditis and subacute granulomatous thyroiditis, mainly Hashimoto and subacute lymphocytic thyroiditis, are mainly called chronic autoimmune lymphocytic thyroiditis. A rare type called Riedel's thyroiditis, Riedel's fibrous thyroiditis. It is of unknown etiology, excessive fibrous adhesions and fibrosis replacing the thyroid parenchyma with features of hypothyroidism and follicular atrophy. Riedel's thyroiditis. This is Hashimoto thyroiditis. Hashimoto thyroiditis. Is a chronic autoimmune disorder leading to inflammation and gradual destruction and functional impairment of the thyroid gland, result in hypothyroidism and increased risk of thyroid cancer. شباب, what is the cause? أول شيء, any idea about the increased risk of cancer in patients with Hashimoto thyroiditis? It is an chronic autoimmune disorder with destruction, inflammation, and commonly features of hypothyroidism. هسه نجيكم هسه شوية يعني نشرح شوية ونسألكم بعدين هالسؤال. Most common cause of hypothyroidism in areas when there is adequate or sufficient dietary iodine. It is more common in female, a middle-aged female, and it is an autoimmune disease. When we say autoimmune disease, so there is a genetic basis or hereditary inheritance. There is an inheritance of certain HLA, DR5 and DR3, with presence of emergence of T helper cells against specific thyroid antigen, which cooperate with the B cells, leading to the formation of the autoantibodies as antibodies to thyroid peroxidase. So both T helper cells, CD4, and B cells are act together in cytotoxic cell-mediated cytotoxicity and in antibody production antibody production by the B cells and even phagocytic cells, macrophage. All these mechanisms lead to follicular destruction. Thyroid antibodies to thyroid enzymes are detected within the serum of the patient. Initially, there is hyperthyroidism. And in long-standing cases, the patient develop hypothyroidism. This is because of the destruction, during follicular stimulation, lymphocytic infiltration and inflammation and destruction of the thyroid follicles. There will be release of the thyroid hormone into the circulation, into the blood. So there is a state or recent or initial state of hyperthyroidism. So it is called hashitoxicosis. And after that, when the process of destruction, follicular destruction by severe lymphocytic infiltration, when there is ongoing attacks of follicular destruction and replacement of the of the thyroid parenchyma by the sensitized T cells and fibrosis, and there will be development of hypothyroidism and the risk of, and there is also an increased risk of B cell lymphoma. So Hashimoto thyroiditis carry a risk of B cell lymphoma, long-standing cases. This is related to long-standing sensitization of the B cells and stimulation, the hyperplasia, and that can be a result or an emergence of monoclonal cells. The same process as in, let us say, celiac disease, long-standing sensitization of T cells. So gene mutation or genetic defect or result in B cell dysfunction. The B cell invade the thyroid parenchyma, forming lymphoid follicle with germinal centers, like what you see in a hyperplastic lymph node. There is continuous B cell activation and autoantibody production by the B cells. Natural killer cells signal to destroy the thyroid follicular cells, and the CD4 cells produces inflammatory cytokines. That is the cell-mediated cytotoxicity, and CD4 cells attack the thyroid follicular cells, release the stored T3 and T4. This is result in transient or initial hyperthyroidism. It is called hashitoxicosis at the start. With the progression of the destructive process and inflammation, long-standing inflammation, follicular destruction will result in hypothyroidism and with a positive feedback mechanism to release pituitary TSH. This is a diagram show you the pathogenesis of Hashimoto thyroiditis. هذا الدايجرام موجود أو الفيجر موجود بالكتاب عندكم. The thyroid epithelium, there will be, it is called breakdown of self-intolerance. Three mechanisms, all of the thyroid follicular epithelium will be destructed by all of these three mechanisms. CD8 or T cell mediated cytotoxicity, sensitization of the CD8 cytotoxicity, CD8 T cell cytotoxicity, in addition to the CD4 activation and to secrete interferon gamma and result in activated macrophages, result in thyrocyte injury. In addition to B cells will be differentiated into T plasma cells to produce antibodies against the thyroid enzymes, and that is antiperoxidase, so result in antibody-dependent cell-mediated cytotoxicity. So autoimmune destruction or autoimmunity of the autoimmune destruction or breakdown of the thyroid follicular cells will be mediated by all these three mechanisms. By infiltrating cytotoxic T cells, cytokine release, and antibody-mediated cytotoxicity. T cell-mediated cytotoxicity and activated or sensitized CD4 T cells and cytokine release with activation of macrophage and antibody-mediated antibody-dependent cell-mediated cytotoxicity, all result in destruction of thyroid follicular epithelium and Hashimoto thyroiditis. So it is an autoimmune process with associated genetic defect in B cells especially, and with associated other autoimmune diseases like rheumatoid arthritis, diabetes, autoimmune sialadenitis, and so on, in the same patient or in his family, more common in female. Certain gene mutation result in B cell dysfunction, and all the process result in heavy infiltration in the thyroid parenchyma with activation of the B cells to produce antibodies against the thyroid enzymes, and the resultant outcome is the destruction of the follicular epithelial cells by three mechanisms. All these three mechanisms lead to destruction of the follicular epithelial cells. Gross appearance, firm and diffused goiter, microscopically follicular atrophy. What is the cause of atrophy here? It is related to autoimmune destruction by sensitized B cells and sensitized T cells, and also differentiated B cells to form antibodies and heavy lymphocytic infiltration. Hair cell metaplasia is a special metaplastic change or eosinophilic cytoplasm and changes in Hashimoto thyroiditis, excessive fibrosis and destruction of the follicular epithelium. This is the gross appearance. The cut section of the thyroid becomes tan-colored, tan-colored, rubbery due to excessive fibrosis, solid, homogeneous, not the fleshy, beefy discoloration of normal thyroid parenchyma. This is the solid, homogeneous, tan-colored due to excessive lymphocytic infiltration within the thyroid parenchyma, in addition to fibrosis. Homogeneous, tan-colored, solid areas or patchy areas of inflammation, lymphocytic infiltration, and fibrosis, seen microscopically as such. Here there is an area called lymphocytic infiltration with lymphoid follicle formation. Here the thyroid follicles undergo destruction. The destruction is mainly seen here in the middle by a heavy lymphocytic infiltrate these are what we call it lymphoid follicles, as if you are in a lymph node. Hyperplastic lymphoid follicles due to this lymphoid follicle with germinal center formation. This gives us an indication of autoimmunity, autoimmune destruction, or autoimmune inflammation. Germinal center in the middle, proliferating B cells in the center, and here the features of hypothyroidism, retained colloid, and feature here the prominent follicular destruction. The follicles are destructed here by the excessive diffused B cell infiltration and T cell. Hashimoto thyroiditis, again, follicular destruction. There is scanty or little follicles remaining after destruction, and this is the lymphoid follicle with central pale germinal center. And this is higher powered to show you the foci of Hertel cell metaplasia. This is areas of metaplastic hair cell, follicular cells to show Hertel cell metaplasia, in which the cytoplasm becomes eosinophilic, and disappearance of cell borders, like sheets of cells with vesicular nuclei. And this is the border of lymphoid follicle, mantle zone, and this is the germinal center. Again, this is a focus for Hertel cell metaplasia. You can identify the eosinophilic, homogeneous, abundant cytoplasm, granular cytoplasm, granularity sometimes, with vesicular nuclei, rounded, large vesicular nuclei, and prominent nucleoli, foci of Hertel cell metaplasia. And this is an adjacent germinal center in the middle of lymphoid follicle. Laboratory investigations showed features of hypothyroidism, that is primary hypothyroidism, diagnosed by decreased thyroid hormone T3 and T4 in the blood, and increased TSH and thyroid releasing hormone levels. So it is a primary type of hypothyroidism, in addition to autoantibodies detected in the serum against thyroid peroxidase enzymes, anti-thyroid peroxidase, and anti-thyroglobulin antibodies, confirming the autoimmune basis of Hashimoto thyroiditis. So patient with hypothyroidism with such thyroid biopsy, and autoantibodies within the serum against thyroglobulin and thyroid peroxidase indicate or are important for diagnosis of Hashimoto thyroiditis, which is the common type of autoimmune thyroiditis. Another type is called subacute or Dikervian thyroiditis, or granulomatous thyroiditis. It is less common, also affecting female 30 to 60 years. Here the enlargement, or it is painful. Pain is manifested by a patient with Dikervian thyroiditis, with associated fatigue and myalgia. These features are related to what, Shabab? Fatigue and myalgia. What are the cause of fatigue and myalgia in patient with subacute thyroiditis or granulomatous thyroiditis? This is an indication of, hypothyroidism. Yes, patient has thyroid destruction. Thyroiditis means destruction of the thyroid follicles and replacement by fibrous tissue and inflammatory cells. result in features of all features of hypothyroidism can result. The eliciting stimulus, the lesion can follow post-viral infection. Post-viral infection can result in this granulomatous inflammation of the thyroid gland. It is also associated with genetic basis. Granulomas can be seen within the thyroid gland. They are granulomas with multinucleated giant cells. Hyperthyroidism can be seen مثل الهاشيموتو thyroiditis at the start نسميه initial or initial hyperthyroidism followed by in advanced stage. Or sometimes if the disease progress or regresses after viral infection, compensation of the thyroid function can result before complete loss or severe loss of destruction of the thyroid follicles. This is you can see in this picture multinucleated giant cells and granuloma formation with multinucleated giant cells in Diacribian thyroiditis. This is called subacute granulomatous thyroiditis, subacute granulomatous thyroiditis, or Diacribian disease or thyroiditis. The another type is called subacute lymphocytic thyroiditis. Clinically and microscopically can be the same as Hashimoto thyroiditis, foci of lymphocytic infiltration with germinal centers with early fibrosis and maybe of an autoimmune origin, can be associated with another autoimmune disease in the same patient and in the other family members. شباب لحد الآن أكو سؤال regarding Hashimoto thyroiditis, Diacribian thyroiditis, or subacute lymphocytic thyroiditis. Any question please? قبل ما نتحول على الثايرويد tumors. Yes. تفضل. Yes. Yes. Yes, exactly. According to so it is elicited by viral infection. اللي يميز انه هو ايضا it is painful enlargement of thyroid gland can be elicited after viral infection with certain genetic basis طبعا. More common in female and also according to the degree features دائما إذا hyperthyroidism أو hypothyroidism أو euthyroidism. euthyroid يعني normal thyroid function and normal thyroid hormone according to the degree of follicular destruction. مرات ينطوهم steroid ويصير response, good response, and the patient restore their thyroid function to normal. إذا without treatment طبعا يصير progression، يصير hypothyroidism. At the start there is hyperthyroidism due to release of excess thyroid hormone after destruction. التريتمنت and يعني course of the disease and the response to treatment will determine whether the disease progress to hypothyroidism or regress to normal or يعني respond to treatment, steroid treatment, and restore their thyroid function. Yes, usually thyroiditis is autoimmune. Thyroiditis in general are autoimmune. الموست common هو الهاشيموتو ثايرويدايتس. هاشيموتو خاصة بالويسترن كانتريز. احنا عندنا ايضا هذا السب اكيوت ليمفوستيك ثايرويدايتس نسميه اوتو اميون ليمفوستيك ثايرويدايتس، ايضا موجود نشوفه بكثرة. In general, thyroiditis is autoimmune. Rarely حال أي tissue بالbody from any infectious process suppuration can reaches the thyroid parenchyma through the bloodstream ويصير السبيوريشن أو يصير يعني suppurative thyroiditis, but it is rare. In general, thyroiditis is autoimmune يعني according to all their types. حتى الهاشيموتو ثايرويدايتس شباب مثل السيلياك، حتى إذا تذكرون الكرونز ديزيز والulcerative colitis, also autoimmune disease can be triggered by virus or certain مثلا carcinogen or certain agent يعني virus أو another environmental factor. With the genetic basis there is a trigger. مو صحيح؟ الأسمى والدايابيتس هذول شنو؟ أو دايابيتس، مو صحيح؟ ليش يصير عندهم هذول childhood أو type 1 diabetes اللي هو of autoimmune أو immune origin, sometimes viral origin, virus can trigger the destruction of pancreatic islets cells. نفس الشيء هنا. Viruses can trigger this autoimmune process. Viral infection can trigger this autoimmune process with the association of the genetic basis and hereditary defects, B cell dysfunction and so on. Okay? But نعم، وكل احنا شلون نعرف الاوتوimmune diseases دائما تجي as a clusters نفس البيشنت within the or within the same family associated with autoimmune and autoantibodies within the serum and يعني respond to steroid therapy. هي هذه الاوتوimmune diseases. هذه rare types, Dickervian والريدلز، هذول rare types. شباب أكو subject اسمه thyroid nodules, how to evaluate thyroid nodules. or the nodule. شباب من نقول thyroid nodule شنو نقصد بيها solitary thyroid nodule. It can be a cyst, can be colloid goiter nodule اللي هي هاي endemic goiter. It can be an adenoma. It can benign, which is benign. It can be carcinoma, which is malignant. Then, so there are steps to evaluate the thyroid nodules. In general خلينا ناخذ فد introduction أو فد فكرة عن thyroid tumors. In general, thyroid tumors are divided مثل بقية systems into benign and malignant. Benign tumor أشهر benign tumor هو الأدينوما, follicular adenoma of the thyroid. Usually it is solitary. أسألكم سؤال شباب لي قدام. What about endocrine gland tumors? شنو حكينا عليها؟ شنو قلنا عليها؟ أكو فد features خاصة بالendocrine gland tumor.
دكتورة تكون functioning أو non-functioning.
Exactly. Functioning or functional. What is functional or what is functioning and what is non-functioning?
دكتورة الفانكشنينج تكون بها سكريشن، بينما النون فانكشنينج بس تكبر بالحجم وتسوي بريشر يعني على الأشياء المدورة بصفها بس ما بها سكريشن.
Yes, functional mean there is excess secretion of one hormone or of one hormone or more than one hormone مثل pituitary hormones مثلا أخذنا شنو أخذنا يا هو هذا اللي secreting more than one hormone prolactin and growth hormone secreting adenoma اللي هي سميناها acidophil adenoma can secrete one or more hormone with features or manifestation of hormone excess or non-functioning. What is non-functioning? Mean the tumor is clinically silent. The tumor is clinically silent. اوكي نخليها ببالنا هذه الفيتشر لان من نقول اكو hot adenoma او toxic adenoma او نقول cold adenoma او non-toxic adenoma. واضح؟ So adenoma is the most common benign tumor of the thyroid gland. Regarding thyroid cancer, they are divided into or classified into papillary carcinoma representing up to 75 to 80%. تجي بعدها follicular carcinoma less common 10 to 20% and medullary carcinoma. قلنا the origin of this type is the parafollicular C cells, endocrine cells, neuroendocrine cells. Whereas the papillary and follicular, the origin of these cells are the follicular epithelial cells. The anaplastic carcinoma is less common, fortunately, and is very aggressive and the most aggressive tumor in thyroid through in between thyroid among thyroid cancer. The thyroid nodule, clinically, thyroid tumors are presented as thyroid nodule. Thyroid nodule. شنو قلنا على هاي thyroid nodule؟ شبيها شباب هسه توني قلت. Solitary. It is solitary. Usually, thyroid tumor is solitary. يعني إحنا من عندنا multinodular enlargement هذا ما نخاف من عنده لأن هو شنو هو هذا عبارة عن شنو؟ It is related to multinodular colloid goiter or endemic goiter. Cervical lymph node involvement or enlargement. Cervical lymph node enlargement indicate what? Indicate cervical lymph node metastasis. Local compression symptom. Local compressive symptom like in hoarseness of the voice or loss of voice. Dysphagia and dyspnea هذه local compressive symptom. Distant metastasis to the lung, to the brain, to the liver, and thyroid dysfunction. These are features, clinical features of thyroid nodule or thyroid tumors. Usually solitary, the thyroid tumor usually solitary and most commonly it is benign. The prognosis regarding thyroid carcinoma, شباب, thyroid cancer, fortunately up to 80% of thyroid cancer is represented by the papillary carcinoma, which it is one of the most, it is one of the cancers with a favorable outcome, with favorable prognosis. Papillary carcinoma has an excellent prognosis. More than 90% cure or complete cure with radioactive iodine intake. So that, and again, the tumor may be functioning. نسميها hot nodule. Hot nodule. معناها شنو functioning؟ معناها there is excessive functioning thyroid follicles and take the نسميها hot لأن تبين بالradioactive iodine أو scanning تبين hot or taking a lot of iodine uptake, with a lot of iodine uptake, excess iodine uptake. Malignancy, it is associated with infiltration or fixation. So fixation or hardness is an ominous sign, and hoarseness of the voice indicate pressure or invasion of the recurrent laryngeal nerve. واحدة من الفيتشرز of ominous features قلنا بس هذا ذكرنا الانابلاستيك carcinoma. It is most commonly seen in male. هذا هو الشيء الوحيد اللي common in male among thyroid cancer, thyroid lesions or thyroid disorders. It can be associated with ominous features indicate fixation. معناها fixation معناها hardness and immobility and hoarseness of the voice, and also recent nodule. يعني يجي الميل old male elderly male يقول there is a recent nodule hard. نخلي في بالنا الانابلاستيك carcinoma of thyroid in elderly man. Okay. The thyroid nodule are very common, very prevalent. Can be seen by or can be palpated or discovered by physical examination or by ultrasound or by autopsy. And the increase and the incidence increases with age, whether it is benign, malignant, colloid goiter nodule, adenoma, carcinoma, whatever the nodule. But solitary nodule is an indication, or it should be evaluated specifically because it can be a tumor. Put in mind, most of thyroid nodules are benign. And these nodules can be اللي هي benign, can be thyroid colloid goiter nodule at the start. من تبدي الcolloid nodule تبدي single, or it can be colloid cyst, collection of colloid cysts, or can be congenital malformation, thyroglossal duct cyst, or can be an adenoma. Again, adenoma is, although it is a tumor, but it is benign. Malignancy in a thyroid nodule or solitary thyroid nodule is 5 to 12%. History of irradiation, especially during childhood, history of irradiation to the neck, especially during childhood, increase the chance of malignancy to 3 to 50%. History of neck irradiation. So history is very important. Family history. If there is a family history, and نسأل female عن her mother, sisters, for any thyroid lesion, for any thyroid enlargement, goiter, nodule, mass, or taking thyroid therapy. Look, the geographical or the location, يعني site for, or the geographical residency in areas with iodine deficiency or not, physical examination, again, history include features of hyper or hypothyroidism, whether increase all the features of hyper or hypothyroidism, and thyroid goiter, physical examination to discover any goiterous changes, enlargement in the thyroid gland or nodule, laboratory evaluation, TSH and fine needle aspiration, cytology. The thyroid function test هو represent T3, T4 and TSH. بس هذا TSH thyroid stimulating hormone test. هذا هو screening test in endemic areas. ما يسوون كل thyroid function test، يعملون فقط TSH level. If it is suppressed, if it is elevated, it is an indicate endemic goiter. If it is suppressed or decreased in level, it is indicate thyrotoxicosis and hyperthyroidism. Fine needle aspiration cytology is very helpful, very diagnostic, very important with high sensitivity and specificity. Imaging studies are lower to fine needle aspiration in accuracy. Again, history in the female manifests thyroid disorders between the age of 20 to less than 50, head or neck irradiation, especially during childhood, family history in the mother, sister, and for any thyroid enlargement or thyroid replacement therapy. Male is important for, as I say, because it, especially elderly male, because the high incidence, or we should put in mind the risk of anaplastic carcinoma in elderly man with recent thyroid nodule. يعني مو مثل الفيميل تجي تقول أنا هذه النوديول صار لها 20 سنة 10 سنوات، صار عندي 10 سنوات آخذ ثايروكسين. لا، recent nodule صار لها شهر شهرين recent nodule, fixed hard, with recurrent laryngeal nerve involvement or hoarseness of voice, cervical lymph node enlargement. These are indications for anaplastic carcinoma in male. Again, recent growth. هذه هم بتخوف. recent growth or recent nodule صار لها شهر، يقول صار لها شهر أو صار لها شهرين، يعني recent or newly formed nodule or newly discovered, with pressure symptoms on the recurrent laryngeal nerve or trachea and esophagus. Hard non-tender nodule. Again, hard non-tender nodule indicates malignancy. Non-tender, usually قلنا احنا most of the lesions are, most of the nodule are benign. Hardness can be associated with calcification, and calcification can be seen in tumor and in colloid goiter also. Non-tender nodule of different consistencies within multinodular goiter. Sometimes this we can see incidental carcinoma in a patient with multinodular goiter. شوفتكم صورة بالبداية عن من كان multinodular goiter with incidental papillary carcinoma. Fixed nodule, hardness, fixation to the soft tissue, fixation, it is also an indication of malignancy. Cervical lymph node involvement or indicate metastasis, and immobile vocal cord and hoarseness of the voice. These are ominous features. يعني من نشوف elderly man with fixed nodule, recent nodule, with cervical lymph node involvement and hoarseness of the voice, hard non-tender nodule. هذه features تخوف. We should put in mind malignancy and like in anaplastic carcinoma or malignancy in long-standing multinodular goiter. The ultrasonography, ultrasound generally has minor role in evaluation. يقول لنا هذا cystic, هذا solid, هذا if it is palpable, we can palpate or we can do final aspiration without ultrasound. If it is a small ultrasound guide, is very helpful. And cystic nodule, again, cystic nodule or colloid cyst or can carry malignancy within the wall. يعني حتى مرات أحيانا يقول لنا هذا thyroid cyst, but بالdissection or during final aspiration, malignancy will be discovered within the wall of this cyst, even if it is colloid cyst. Solid nodule, this is the homogeneous hyperechoic nodule by ultrasound, can be hypervascularity increase, نسوي له Doppler, hypervascularity increase the risk of being malignant, even though the hyperplastic nodule اللي قلنا عليها hyperplastic nodule, which is the commonest cause of thyrotoxicosis in our country, can also be associated with increased vascularity. Toxic adenoma also associated with increased vascularity, but also a malignant tumor is associated with increased or rich vascularity. Hypervascular nodule. So fine needle aspiration cytology. Fine needle aspiration cytology is the most important test to evaluate the thyroid hormone, so it is more definite. The high sensitivity and high specificity. The sensitivity is up to 100 and the sensitivity is up to 95. and it is important to differentiate whether the nodule is benign or malignant, and to give even the subtype of the malignancy. And it is easy, rapid, and cheap, and not harmful, not invasive, and can be very, very easy and very useful and very informative, with minor or undetectable or unrecorded side effects. Most had a thyroid radioactive scan or radionucleotide scan, هذا or technetium scan. Most thyroid gland are cold. 95% of thyroid nodules are cold. Cold mean there is no increase in thyroid or iodine uptake. Most cold nodules are benign. Hot nodules are usually functioning and can be detected by TSH suppressed, or يعني ينطون للبيشنت TSH يصير suppression للsecretion of T3 T4. And warm nodule can be malignant, يعني malignant nodule can be non-functioning. هذا هو radionucleotide scan. This is the homogeneous uniform distribution of the iodine uptake by the thyroid gland. So it is concentrated by when it is administered by the patient, is concentrated by the thyroid gland and result in this homogeneous pattern normally. Increase in density or increase in darkness, which is when it becomes diffused, indicates in the case of diffused follicular hyperplasia, that is Graves' disease. This is a picture of Graves' disease, a radionucleotide scan of Graves' disease. Higher uptake of iodine. Whereas this disproportionate uptake, شوفوا مكانات hyper مكانات dark ومكانات cold، أو نسميها هنا hot nodules، هنا cold nodules and warm nodules، يعني normal lowered و increased uptake. This is an advanced stage of multinodular goiter with hyperplastic nodule. This is what we call it commonest cause of hyperthyroidism in our country. And here, this is the cold nodule within otherwise homogeneously or normal iodine uptake. This is most commonly called cold nodule, related to colloid goiter nodule, colloid cyst, even sometimes carcinoma can be called. This is a summary to what I said previously. Concentration from the blood from the radioactive iodine, allowing to show if there is hyperfunctioning or hypofunctioning. Dark spots indicate increased uptake of iodine, normally diffuse moderate iodine uptake throughout the left and right and isthmus. Graves' disease characterized by diffuse increased uptake. Multinodular goiter show patchy irregular uptake, cold, hot, and warm nodules, and the cold nodule characterized or can be seen in thyroid neoplasm and cyst. Focal nodule, focal rounded area with increased uptake that suppresses the remaining thyroid gland. It is seen in hyperfunctioning adenoma or toxic colloid goiter, toxic multinodular colloid goiter. يعني إذا أكو thyroid nodule, this is a normal uptake, homogeneous, and here hot nodules or disproportionate hot nodules, nodular hyperplasia, and here cold nodule. This is a cold nodule with thyroid gland. If there is hyperfunctioning, ما مرسومة هنا ما موجودة. If there is hyperfunctioning, hot nodule can suppress يعني مثل هذا يعني في hot nodule suppresses the adjacent thyroid tissue. It is, can be seen in adenoma, toxic adenoma, or dominant hyperplastic nodule in multinodular colloid goiter. Again, most thyroid nodule are benign. TSH will determine the function. ليش هذا شنو سميناه TSH level؟ شنو سميناه هسه شباب؟ TSH determination. TSH determination. Serum TSH level. شنو it is helpful when يستخدموا as a screening test in endemic areas. TSH will determine whether the thyroid nodule is functioning or not, and functional status. Thyroid scan and ultrasound are not helpful like in FNA. FNA is the most helpful diagnostic procedure and safe. Regarding adenoma, follicular adenoma is the most common. It is usually solitary. يعني عادة almost always follicular adenoma is solitary. Compact follicles and small proliferating follicles, and it is solitary. It can be hot or cold or warm. Sometimes نسميها من تصير hot أو functioning نسميها toxic adenoma. Toxic adenoma mean functioning follicular adenoma. In the center, hemorrhage and necrosis and well encapsulation. This is the gross appearance. شوفوا هذا typical follicular adenoma, very thick capsule with well demarcated margins of the capsule, surrounded by thick fibrous capsule and compressing the surrounding remaining thyroid parenchyma with central homogeneous neoplastic growth and associated with bleeding. Again here, well demarcation from the surrounding parenchyma and central bleeding, not necrosis, bleeding, it is bleeding. Again, it is solitary. Follicular adenoma is almost always solitary. ما بشي اسمه 2 adenoma. لا. Well encapsulated, neoplastic, compressing the adjacent parenchyma with neoplastic tan-colored cut section and central bleeding sometimes, most commonly. This is the cut section of follicular adenoma. Follicular adenoma, اسمها follicular, means it is formed of proliferating microfollicles. شوفوا هذه normal follicle, thyroid tissue compressed by the tumor. The thyroid follicles are seen here with colloid inside. Here, scanned colloid, hyperproliferating microfollicles or proliferating microfollicles surrounded by thick capsule, no features of invasion. This is important. Well demarcation and well encapsulation by thick capsule without invasion, because follicular adenoma differentiated from follicular carcinoma by presence of capsular rupture, capsular and and or vascular invasion. Capsular and or vascular invasion. يعني هذه نفس picture of follicular carcinoma. When we see capsular invasion and or vascular invasion within the thyroid follicular adenoma, for thyroid follicular tumor, it is called follicular carcinoma. خلوها بالكم differentiation between, or how can we diagnose follicular carcinoma, follicular neoplasm with capsular and or يعني low high, low capsular invasion, low vascular invasion. Capsular and or vascular invasion differentiate follicular adenoma from follicular carcinoma اللي هي less common. قلنا عليها 10 to 20%. 75 to 80% هي papillary, 10 to 20% is follicular carcinoma. Hürthle cell adenoma is a variant of follicular adenoma with Hürthle cell change or oncocytic cells. eosinophilic cytoplasm and vesicular nuclei. Classification of thyroid cancer, it can be divided into epithelial cell tumor. The differentiated are the papillary carcinoma and follicular carcinoma, and the undifferentiated is the anaplastic type. اللي قلنا عليه هذا بالmale recent nodule, fixed, hard, with hoarseness of the voice, cervical lymphadenopathy, and increased incidence in elderly men. Whereas the other type اللي هو non-epithelial parafollicular C cells اللي هو neuroendocrine cells, and the medullary, which is called the medullary carcinoma, اللي هو malignant carcinoid. هذا هو أو medullary carcinoma نفس الأوريجين. And lymphoma شباب هذه وين, where is the in whom or in which patient there is an increased incidence of thyroid lymphoma. In which disease entity there is an increased risk of thyroid lymphoma?
دكتورة بالهاشيموتو ثايرويدايتس يصير بي سيل ليمفوما.
Yes, B cell lymphoma or diffuse B cell lymphoma is a risk factor. There's an increased incidence of development of B cell lymphoma in advanced Hashimoto thyroiditis or autoimmune thyroiditis. Thyroid cancer is uncommon, and it is sometimes can affect any age, usually young age and usually young to elderly age group. قلنا the prognosis is is excellent, especially for papillary carcinoma of thyroid. فقط الانaplastic carcinoma carry poor prognosis. الcommon type هو papillary adenocarcinoma, 75 to 80% fortunately, and associated with radiation exposure during childhood and adolescence. The type papillary carcinoma, young age group, lymphatic spread with excellent prognosis, whereas follicular carcinoma affecting middle age group, vascular invasion. The invasion is vascular here. هسه استونا شنو قلنا شباب? How can we diagnose follicular carcinoma of thyroid? How can we differentiate?
Capsular or
Yes.
capsular
Yes.
or invasion.
Capsular and or يعني لو هاي لو اثنيناتهم، مو صحيح؟ Capsular and or vascular invasion. Differentiate follicular adenoma from follicular carcinoma. مو صحيح؟ زين. Also associated with good prognosis, whereas anaplastic in elderly associated with local invasion or local adhesion to recurrent laryngeal nerve or to the cervical lymph node with bad prognosis. وقلنا عليها هذه elderly man with recent nodule, hard, fixed with recurrent laryngeal nerve compression and fixation or cervical lymph node enlargement should be considered seriously in elderly man. Medullary carcinoma, neuroendocrine origin or tumor of parafollicular C, familial predisposition in elder and can be spread by all these mechanisms with variable prognosis. According to the stage, in general, papillary carcinoma, this is the most common, radiation and gender and Cowden syndrome, risk factors, and papillary falls, Samoma bodies, and orphan Annie eyes. Survival rate is 98% survival rate. This is the typical gross appearance of papillary carcinoma: solid, ill-defined margin, مو مثل الأدينوما اللي شفناها, surrounded by thick, well-defined capsule. هنا نسوي نشوف under the microscope نشوف features of invasion, infiltration of normal parenchyma. Here the surrounding fleshy colored thyroid parenchyma, there is no extrathyroidal extension. Still the tumor is within the confines of thyroid capsule. The thyroid capsule هذه مبينة without rupture of thyroid capsule. السايز أيضا مهم. Invasion of the thyroid capsule is important. Presence of cervical lymph node is important. Even يعني papillary carcinoma with cervical lymph node metastasis carry good prognosis. يعني even with cervical lymph node metastasis حتى هي أصلا حسب ال A يعني according to the age يعني whatever the size in patient less than 45 and female less than 45 years of age, it is diagnosed as stage 1. Whatever the size of the tumor in patient with less than 45 years of age, it is a stage 1 disease, papillary carcinoma and even follicular carcinoma. This is an intrathyroidal papillary carcinoma surrounded by parenchyma. Here the tumor شوفوها شباب it is a neoplasm. هذا لا هو cyst ولا هو colloid nodule ولا هو calcification. هذه ال areas of calcification اللي تنشاف أيضا can be seen with ultrasound, which increase the suspicion of nodule to become suspicious and to necessitate the FNA aspiration. هذه areas هنا of capsular rupture and invasion of the parenchyma can be seen in hazy areas. As the tumor is solid, whitish with papillary unfolding. These are papillary structures. Papillary excrescences are here very prominent within a cystic. لهذا قلنا شباب قلنا cyst. So thyroid papillary carcinoma can be seen within a cyst. Here لهذا أي cyst, any cyst with solid component should be aspirated. إذا أكو في thyroid cyst أو colloid cyst, any solid component or papillary projections should be aspirated by fine needle aspiration. This is a papillary carcinoma or intracystic papillary carcinoma. Okay, this is typical or classical appearance of papillary carcinoma of thyroid. What is this? This is an intrathyroidal lymphatic invasion. قلنا papillary carcinoma spread through lymphatics and follicular carcinoma mostly spread via blood vessels. So this is a نسميها satellite nodules through lymphatics يعني permeation or through lymphatic invasion within the thyroid parenchyma from the original one. These are true papillary structures and formation of papillary carcinoma with central fibrovascular core. مو مثل pseudopapillary tufting أو folding of Graves' disease or hyperplasia. There is a true fibrovascular core within the tumor. The tumor is formed by multiple papillary structures with central fibrovascularity or fibrovascular core. This is the normal non-neoplastic gland tissue. The characteristic feature هاي قبل شوية ذكرناها orphan Annie eyes or orphan Annie cell eyes أو هذه النيوكلير features اللي نعتمد عليها بالdiagnosis including cellular clearing, nuclear clearing. شوفوا شباب نشوفها optically clear, نسميها optically clear. من نشوف under the microscope كأنما the nucleus is empty. These are features in addition to the papillary structures, true papillary structures, the nuclear features including optically clear or orphan Annie eye and other feature is nuclear overlapping, يصير وحدة فوق الأخ, nuclear overlapping, nuclear inclusion and some homobodies here, nuclear overlapping. This is then inclusion is most commonly seen in fine needle aspiration. Nuclear inclusion, مثل viral inclusion, like homogeneous rounded structure within the nucleus. And these are the true papillary structures, true fibrovascular core forming the tumor. And هذه الفيتشر إذا أحد يعرفها هي نسميها coffee bean appearance or nuclear grooving or clefting. So nuclear features are depend, and we depend on it for diagnosis. In addition to the papillary structure and invasion of the tumor, they are include مثل ما قلنا هسه nuclear clearing like orphan Annie eyes and nuclear inclusions. هذه nuclear inclusions like rounded globule within the nucleus, overlapping and nuclear grooving. Nuclear grooving نسميها coffee bean nuclei. Okay. Medullary carcinoma, هذه non-epithelial tumor originate from the parafollicular C cells, and the medullary carcinoma, the interstitium is rich in amyloid that is discovered or seen in polarized microscopy, and anaplastic carcinoma. That is what is rich. We need to شوفوا يا شباب anaplastic carcinoma لا هي papillary ولا هي follicular. anaplastic تشبه الساركوما أو undifferentiated cells. هي هذه اللي قلنا عليها. Carry bad prognosis in elderly man with a recent nodule, cervical lymph node enlargement, hoarseness of the voice, fixation of the nodule and hardness. هذه features كلها تخوف, should be taken seriously in elderly man. Okay. أكو شيء سؤال شباب على التيومرز على أي anything أو على assessment of thyroid nodule. Any question شباب؟ واضحة الأمور؟ Do you have any question, please? Okay. So thyroid lesions, thyroid tumors are very important, very essential. يعني الثايرويد lesions, thyroid nodule diseases, you will see every day or in every subject in the pediatric, in medicine, in surgery. Thyroid lesions are very common in our country and in our locality, and it is very important to know, to assess the thyroid nodule, whether it is benign or malignant, and to how to reach the proper diagnosis, how to carry how to follow the rule of history, physical examination, laboratory test, ultrasound, final aspiration. These are the steps. Okay. إذا ما عندكم سؤال أنا خلصت. شكرا جزيلا. عندكم سؤال شباب؟